We are covering mental health in the medical field, and we are social and moral development group. It's presented by
Ashley Corona.
Rosanna Diaz.
Tony Hinojos.
Andrew McNeil.
Paige Nava.
Javier Ramirez.
And Grace Tamayo.
And Ashley A is no longer with us. Our mission statement, we wanted to analyze the effects of moral distress in healthcare. We wanted to highlight how ethical dilemmas and the pressure to uphold patient-centered care can impact the mental health of providers and caretakers. And we also wanted to cover how healthcare workers can deal with their emotions while working, create a separation from their work life, and deal with negative career consequences. Our theorist was Kohlberg, and he had 6 stages of moral development. Stage one was the pre-conventional stage, which was obedience and punishment, self-interest and rewards, and that was usually adolescents and young kids. Stage two was the conventional stage with social approval and law and order, and this was teens to young adults. And stage three was the post-conventional stage, which was social contracts and universal ethical principles, which was older adults.
For post-conventional morality in healthcare, we're going to be looking at stage 5 of Kohlberg's theory, the social contract and individual rights. Individual rights recognize that laws and policies should support fairness and human well-being. Healthcare workers may experience moral distress when institutional policies conflict with patient needs. Providers often advocate for patients even when facing insurance limitations, staffing shortages, or administrative pressure. This this connects to healthcare, and a good example of this is how a physical therapist may believe a patient still needs treatment even after the insurance coverage for their treatment has ended. We'll also be looking here at stage 6, a universal ethical principle. Healthcare professionals may prioritize patient dignity and well-being over rigid institutional rules. Providers rely on personal moral principles when making difficult healthcare decisions. And a good example of this is nurses in during COVID-19 had to continue providing patient-centered care despite emotional stress and uncertainty. Some essential questions. Why is it important to prioritize healthcare providers' mental health? Moral distress can lead to burnout, anxiety, and emotional exhaustion. Can moral distress result in patient neglect or negative career consequences? Emotional fatigue may affect communication, decision making, and quality of care, which is bad for both the patient and for the provider. How can healthcare workers apply these lessons in practice? They can apply this by developing resilience, ethical awareness, and healthy coping strategies.
Healthcare workers directly face ethical determinants in patient care. Emotional distress can navigate impact empowering healthcare, mental health in job professions, burnout, anxiety, emotions, and exhaustion, and common in high stress health healthcare environment, providing many struggles in balancing patient-centered care and with urgent policies and limit resources. Health explain nurses making end of life decisions, oncology workers during COVID-19.
Some interests we have are improving healthcare workers and mental health and emotional resilience, and supporting ethical decisions making in healthcare settings, promoting patient-centered care while reducing burnout, and encouraging communication, teamwork, and support systems in the workplace. Some group career connections will be pediatric nursing advocacy, oncology patient support, and physical therapy patient advocacy, and end of life ethical care.
So the constraints and restrictions in this research are that there may be staffing shortages and heavy workloads, fear of negative career consequences for speaking up, emotional stress from patient suffering and death, insurance and healthcare policy limitations, and difficulty separating work-related stress from personal life. The understanding and observations our audience will be able to understand are that self-awareness improves ethical decision-making, burnout can affect provider performance in patient care, communication and support systems reduce moral distress, ethical development continues throughout adulthood, and emotional resilience is important in healthcare professions. So being in the right headspace and recognizing moral distress factors reduces the chances of burnout and overall errors. Resilience doesn't only combat moral distress, but it's a necessary trait to have in sustaining a career in healthcare.
Now we'll be talking about and sharing about our careers and real-world experiences that we will be having in our jobs. So first up, Andrew will be sharing his.
For nurse anesthesiologist connections for end-of-life care and organ donations, nurses play a key role in organ donation and end-of-life care, and ethical responsibilities can create emotional and moral distress.
In pediatric nursing, pediatric nurses explain procedures in developmentally appropriate ways. Nurses balance patient advocacy with parental authority. In pediatric nursing, it's important to include children in healthcare decisions at a level they can understand. This helps build trust, reduce fear, and support patient-centered care while still balancing parental authority.
Pediatric nursing in the emergency department is a high pressure environment, which gives providers little time to think. So emergency nurses must adapt to unpredictable situations. Pediatric emergency care is family centered, so you'd have to deal with the child and the parents in anxious and overwhelming situations. So emotional recovery and resilience are essential. Potentially inappropriate care can harm a patient's well-being and can be avoided by being more cautious and intentional in creating that safe environment.
The work oncology nursing faces physical stress during COVID-19, providing emotions burning during patient outcome.
My name is Paige, and mine was on radiology and hands-on simulation. The hands-on simulation training can make medical students more interested in interventional radiology. The study that found that students who practice using simulations understand that the field better, feeling more confident, and were likely to consider radiology as a future career. It's a systematic and pressure and lacking in support, and it's essential that we get students and other people in the field to try and practice. And they saw that the articles had shown that it was more effective than listening to lectures and getting a hands-on feel for it.
My name is Tony. I cover death and grief in nursing. The articles that I looked at surveyed about 100 nurses, and they all talked about their exposure to death and how it really affected their mental health and made working in the field even harder. So it talked about how having healthy coping skills can reduce burnout and ethical fatigue. So having people like therapists or friends on the job you can talk about the stress of the job with can really help you and make sure you're not falling behind in work and making mistakes in healthcare.
For a career in physical therapy, both physical therapists and physical therapy assistants experience moral distress when it comes to patients and the end of their coverage at times. And you can look at this during COVID-19, where there was increased isolation and burnout. Physical therapists had a lot of work to do, and in the home setting, you have much less equipment and less ability to interact with nurses, doctors, that sort of thing, which makes your job much more difficult. That's why it's important for you to be aware of your mental health and of burnout.
Varied learning styles are visual learners. They use charts, images, and infographics. Auditory learners use discussion, oral presentations, and question prompts. And kinesthetic learners use ethical dilemma activities, reflection exercises, and scenario analysis.
Key knowledge and skills, emotion, technique of decision making and the stress, the healthcare environment, communication, complex and patient care center, organizing signs of burnout, mental stress, building realization in healthcare profession, patient-centered care, also leadership, teamwork, and critical thinking in healthcare.
Audience self-assessment. Performance tasks include analyzing ethical healthcare scenarios, reflecting on future career challenges, and discussing responses to moral distress. Evaluation criteria includes participation, critical thinking, understanding theory connections, ability to apply concepts to healthcare. And reflection questions include how would you respond to ethical stress, and what strategies help prevent burnout? Conclusion and next steps. Colbert's stages describe how moral development is experienced and resolved. Mental health support for healthcare workers improves both provider well-being and patient care. Understanding moral development helps healthcare professionals make ethical decisions under pressure. Supporting competent practice and addressing inappropriate care creates effective healthcare teams. And finally, future healthcare workers should prioritize communication, resilience, and emotional self-awareness. Thank you all for listening to our presentation today. We hope this presentation helps show the importance of moral development, mental health, and resilience in healthcare. We really appreciate your time and attention. And here are the sources we used.